Okay.
Yes, sir. So, like that cover page, we have mentioned like title. Uh,
Okay. So you have used the template now.
yes.
No problem. So that's a extended thing that you have done. Anyways, that's fine.
Yes. Market authorization holder, we did not get name, so simply we kept as a XYZ.
That's fine.
And period covered is we have captured like 1 Jan 2023 to 24. And date of report submission as per 70 day we have captured. We thought like after 2 years, like as per PSUR frequency. So already 2 year has come submitted this PSUR. So it is 1 year frequency. So as per 70 days, we have taken as a 11th March 2024. Version number simply we kept as a version 5 only, just in assuming that already it has submitted 4 times. So this is the 5th time we are submitting. So version number we kept as a V5. Confidentiality statement, we didn't get any idea that what to keep in that. So we left blank only. And executive summary, we have mentioned this thing. The periodic benefit risk evaluation report, PBRER, provides a detailed assessment of the safety and benefit risk balance for hypotensa, lisinopril, and antihypertensive from period of 1 Jan 2023 to 1 Jan 2024. Drug indicated for the treatment of hypertension, 5 mg, 10 mg, and 20 mg doses form. During the reporting period, overall received from different sources. The report, I think the period overall something, I think mistake is there. The period overall report from different sources, whatever we have received is 15% spontaneous report, 20% literature, 15% clinical trial, and 15% regulatory submission. In these reports, differentiated based on the serious and non-serious and fatal report. So in that, totally serious adverse event are 35%, non-serious adverse event are 65%, and fatal cases were 3%. Based on the sales data, approximately 5 lakh patients were exposed to hypotension in the last 6 months of these. Of these, 12% were elderly, that is 65-year-old, less than 65 year, and 5% had renal impairment. So summary of new safety signal, regulatory action, that is newly identified risk, one case of DRESS syndrome that is not present in RSI, and risk was this, and second risk was that increase of frequency of angioedema. And regulatory action taken, that EMA requested RSI update for DRESS syndrome, and FDA issued a drug safety communication on angioedema frequency. K conclusion and proposed action.
Sir, I have one question here. Yeah, means why there is a difference? Why EMA is updating the labeling with DRESS syndrome, and FDA is just doing the further monitoring for frequency, angioedema frequency? Why FDA did not do the update labeling update with DRESS syndrome?
See, this is a hypothetical thing. Okay, I have kept this as a hypothetical, but in real scenarios, most of the time, this will be one action that we will get from the regulatory authorities. Okay, and there might be some, so we are submitting reports, we are receiving reports, we need to submit some reports to the FDA. Not all reports will be submitted to all countries. So depending upon the various factors, you will be submitting. So that will all decide like whether, and the regulatory authorities will receive similar kind of reports for the other products or from the other manufacturers as well. So they will propose some actions depending upon what they have seen and depending upon the regions. So it is not mandatory that if something is observed by FDA, then EMEA will also observe the same thing. No. What has been submitted to EMEA will be looked into, and what is submitted to FDA, that will be looked into.
Right, yes. Yes, sir. Thank you.
Okay, sir. So key conclusion and proposed action. So this was, we were discussing on that. So our conclusion was like mainly that things that conclusion like how many patient has been exposed. So we were discussing during that time. So conclusion we will give, already there was 2 warnings. So definitely DRESS syndrome we will add into our RSI document because signal has been emerged. Second thing is there angioedema frequency we want to check, like on which patient, which doses, that thing is going on. So our main proposed action was on that thing, like we will try to start more post-marketing surveillance study on the basis of doses and on the basis of population, their races, and all these things. So at least we will get the idea, because somewhere there was mentioned in the document also that Asiatic populations are more prone to the angioedema and all these things. So we will get the exact data. Then after exact data only we can conclude something and we can go further. So presently action is like we will start more studies and differentiate different races, different populations, and different doses form. On that basis only we will do. So till now here only we did, rest of the part we didn't do.